Hi, so welcome to this week's video blog. This time I have a lacrosse ball in my hand, so it's a very firm ball, size of almost a cue ball or tennis ball. In fact, I used to use tennis balls when I tell people to do their own pressure point release or soft tissue release. After reading some books, and I'll give credit to the mobility WOD, Dr. Kelly Starrett, who's a physical therapist in California, lacrosse ball is pretty much all you need. Very inexpensive, very firm. And at first we usually show people on the wall how to do self-pressure point releases. Anywhere you have muscle in the body, you could do a pressure point release. I'm going to do a couple common ones that we see: neck, shoulder pain. So if you go to your upper trap between the neck and shoulder area, or even down between the shoulder blade and spine, there's a lot of really tight areas that you probably have, and they're muscle knots. People call them muscle knots, and here we call them trigger points or pressure points. So what we do, or what you would do, is you get a lacrosse ball or something equivalent, put it between you and the wall, and use some movement to find and assess where you're the most tight and painful. And right now, I happen to be rolling over one that just feels like a tight rope or a knot. Some people describe it like a marble in there, and I'm going to readjust it there just to get right on the area. Once you find a painful area, that's abnormal tissue. Normal tissue is just pressure. Abnormal tissue is pressure and pain. It might even refer pain down your arm or neck. This might be the cause of some of your headaches. So what you would do is find that area, move on it, using your body, go up and down, side to side. You could even do like circular motions. So we're into that whole three-dimensional movement on the ball on the wall. That's part one. Actually, part one is find it. Part two is move on that area. And then the third part and final is to actually hold and gradually put more and more pressure directly on the target, or where there's the most pain. And then what you do is spend about 2 minutes, maybe longer, but a minimum of 2 to get the release. And I'm just holding on the most severe part of that trigger point. And then once you feel it release or loosen up, you find some other ones. You might go to either side, or you might just stay on the side that really gives you the most problems. So find it, move on it, and then release it by applying a gradually increasing pressure. The slower you go, the better the result. When we do our hands-on trigger point therapy in here, the slower that I've gone with people, the better short and long-term lasting results that they get. So I always think go as slow as possible. Instead of just finding it and jamming it in, you want to go very slow. Like always, if you have any questions or comments, definitely call, stop by, email, check out our website, all that good stuff. Thank you very much.